Attention please. An emergency state has been activated due to the coronavirus.
Meow! Hey everybody, this is a short supplementary video to clarify a few points and to explain how you should always go with your gut, especially when it's a big one. So, Advil, ibuprofen, I never use it. I recommend people don't use it. I've said that for years on my channel. I don't like it. It expires in a couple of years anyway and is ineffective. And there is some vague, non-great research that suggests that it can cause some issues, middle-aged and older men specifically, that I wasn't really smart to take if there's other things, and of course there is. There's Tylenol, paracetamol. That is the go-to for pain relief and anti-fever, providing you don't have any liver issues, and I would say kidney issues as well. It's also highly, highly toxic. So you don't want to take the maximum dose, the maximum dose, the maximum dose day after day. It's really dangerous. If you take 12 Tylenol at one time, I've seen people have their liver killed from that. Whoomp. It's very toxic. So what I'm suggesting is aspirin, not Advil. Now aspirin's getting a bad rap for being a non-fever reliever. It is a fever reliever, it works, and it'll help the aches. So this is my schedule. I wake up, I'll take 1 or 2 Tylenol, depending on my temperature, if it's elevated, and how achy I am. 2 hours later, I will take 1 or 2 aspirin, depending on how achy I feel. 2 hours later, I will take 1 to 2 or no Tylenol, depending if I have a fever and how achy I am. 2 hours after that, 1 to 2 aspirin. I hope that clarifies that. Now, yes, the French are saying that Advil's bad. Totally. Don't take it, right? Any vague research we get, don't take. Bear in mind, these studies are very short duration studies with a very limited audience. If you pays your money, he takes your choice. Now, there's an old adage that a little knowledge is a dangerous thing. And it is. It has been felt for some time that allowing a person to have a high fever, as long as it wasn't frying the brain, hyperpyrexia or normal fever pyrexia, was good. It helps the body speed its metabolism up, the theory being, without any evidence, that that helps you beat the infection. You also, by raising your temperature, the theory being that you're making your body less pleasant for the virus to replicate in. All good things, totally get that. At home, without 911 availability, with somebody very sick, at home, not in the hospital, I am going to treat the fever and get it low. The reason being, dehydration will occur rapidly in the home setting with a fever, whether it's pyrexia or hyperpyrexia, very, very quickly. You don't have access to IV infusions. You could try rectal rehydration. It works, it's reasonably safe, but it's a bit of a skill. There's a few things you can do before you give Tylenol. I'm giving Tylenol. I want that temperature down. I don't want to be throwing the person around, giving them rectal fluids until they're very sick. It won't go down well at all. So I hope that clarifies it. There's obviously no clinical science behind this. It's my opinion, right? I am treating the fever at home. I don't want somebody's temperature up at home if I can give Tylenol and aspirin to reduce it. For the simple reason, I think the dehydration will kill them faster than anything else. Totally different in hospital. Totally different. Because we have IV infusions that we can draw blood work and we can test. Okay? The other thing is, I said that the United Kingdom government was expecting 8 million to die. I think I said that. What I should have said was they're planning for 8 million to be infected, which would give them a death rate of 80 to 240,000 worst case. So that's what I should have said. I think it's either one of the videos coming up. So I'm just saying that right now. Oops, they're not expecting a dramatic death rate, not 8 million to die in the United Kingdom, at least ways not from COVID-19. Once toilet roll runs out completely in the United Kingdom because they don't really have any forest left, then I expect maybe 20 million will die as the rioting breaks out over toilet roll. That of course is a joke. So the video after today is actually going to be from the 15th of March talking about updates, and of course things are rolling along, right? I mean, the news cycle now is like 1 second, right? But there's a few different things out there that have happened that aren't being reported. My hospital, and I believe the other hospitals in the Greater Toronto area and possibly Ontario, are no longer screening any patients for any infectious disease other than COVID-19. I believe we'll still be testing for HIV and hepatitis when it comes up, We're not testing for MRSA, VRSA, CPM, all of those infectious diseases. We are no longer screening for them in the emerge. We're no longer going to do the tests on the floors. This means that people with disorders like VRE, which is an infection that's vancomycin resistant, are going to pass it along much more readily than normal. Now, before everybody freaks out, there's a lot of first-class healthcare service in the world that don't actually screen for these diseases anymore because they're endemic. And yes, you can catch them, and yes, you can die from them, but it's fairly rare. So that's something that's going to be new. We're not doing a whole bunch of specialized microbiology testing anymore. Simple reason, we need to do COVID-19 testing. So that's an interesting one. Like I said, all student nurses, all student physios, all student pharmacists have been banned from the hospital for the duration. I'm not altogether sure that's the smartest move, but that's what we're doing. People in pre-grad should be allowed to stay there, consolidation as it's called now, because they're just about to be trained, and it seems ridiculous to take them off full-time work where they're mentored with a full-time member of staff to delay their training 6 months or a year before they're actually a trained RN or a trained RPN or a trained physio or a trained whatever. That's kind of crazy, but that's the world we live in. There's also persistent rumours that Toronto might be facing a curfew. I'm not actually altogether against that. I think we do need to stop people going out and getting wrecked. Social distancing does work to stop human-to-human transmission. The question is this disease bad enough for us to actually do all of this mega stopping of social distance? My answer is yes, it is. Just by looking at China, Rome and Spain, it's pretty apparent that this will absolutely hammer blow the healthcare system and kill a lot of doctors and nurses. And I'm a nurse and I don't think that's acceptable, and I don't think money is more important than my life. You may disagree, and certainly we're going to have hard economic times from all of this. We don't need to at all. We didn't need to waste all that money trying to prop up the stock market that's going to collapse in a pandemic. We could have sent checks to every Canadian, personal checks from the federal government, actually rebate people $1,000, $2,000. It would be really helpful right now. But that's not what governments exist for anymore. They exist for the corporations, not for the people. And it's pretty apparent from the handling of COVID-19 that the governments are not interested particularly in relieving anxiety and stress in the population, when they easily could. It's much more important for them to try and prop up Amazon's share price. I don't get it. I mean, I do get it. It's criminal corruption. What I don't understand is why anybody thinks any government that does that is at all worthy of their spot. But there you go. I guess Russia and all of that stuff will be aimed at me from this, but I just don't agree. Governments exist for the people. The people's health is more important than anything else. Always has been. Anyway, a few bits and pieces from Arnold Schwarzenegger. The opening of this was Spain announcing the coronavirus.
Come on. See, the important thing is that you stay at home because there's a curfew now. Okay, no one is allowed out, especially someone that is like 72 years old. After you're 65, you're not allowed out of the house anymore in California. So we stay home and we eat here, right? Oh yeah, that's yummy. I ate with whiskey, and there's Lulu. Lulu loves carrots. Whiskey loves carrots. I just had my little bit of vegan food. Oh, that was yummy, huh? Oh, see, that's what we do. We don't go out, we don't go to restaurants, we don't do anything like that anymore here. We just eat with whiskey and with Lulu, we have a good time, we get entertained. Look at that beautiful smile she has, huh? Oh yes, stay home. Okay, whiskey, huh? You, and I have you in my neck. Mwah. Yeah, whiskey. And you, I have you too. Now I have both of you. Look at this picture here. Yeah. No biting. Okay, you got to get along. Because we're in very small quarters. We have a very small house here. Yeah. Good girls. I love it. Good girls.
You must stay safely at your accommodation or home and follow instructions from local authorities or from your accommodation provider. Avoid beach areas and promenades. Keep a safe distance with other people. Stay at home. Thank you and sorry for the inconvenience. Benidorm Town Hall.
This was a Good Cat 2020 production. Hey Marmalade!